Hello folks, this is Ali Nasseh, and today's tutorial is on an important topic that pertains both to the dentist and to all patients. While browsing around the internet, I came across a few videos by a number of dubious characters with titles such as "Root Canals are extremely toxic" by Dr. X, or "Holistic Dentist recommends ozone therapy" by Dr. Y, etc., etc. Basically, these individuals were propagating the myth that root canals are the cause of most of today's ailments and all human afflictions. Well, let's examine these assertions a little bit more closely. The association of unexplained diseases that affects the human body and disease processes to complex medical procedures that require a little abstract thinking in order to understand goes a long way back in our history. We've had many negative claims like this in the past. An example that comes to mind is the fear of water fluoridation in the 1940s that keeps on resurfacing every now and then, but in fact has been a proven and significant public health advance in the reduction of dental decay in the general population. And there are obviously many examples like these standard practices with proven records in our society. However, conspiracy theories against them keep on resurfacing from time to time, and particularly when a new generation of activists discovers old debunked ideas for the first time and mistakenly thinks that they've discovered a novel truth that explains the unexplained. This kind of thinking is not a problem generally until the persistence of this vocal minority, even in the absence of any corroborating evidence, begins to affect the health of the public at large. I think we've all seen examples of this by those who refuse childhood vaccination based on unsound theories propagated by unqualified experts, which puts the rest of the population's health in jeopardy. Such anti-mainstream and unfounded ideas keep on resurfacing only to be proven wrong over and over again. As my college history professor used to say, what we learn from history is that we don't learn from history because we keep on repeating the very same mistakes over and over in these endless cycles. The latest craze condemning root canal is basically another example of this very same phenomenon. So a group of self-proclaimed holistic healers claim to fame is the notion that root canals cause health hazards. I mean, I can't even call these ideas controversial because for something to be controversial, enough people have to really subscribe to the argument in order to create a reasonable counterpoint to the conventional thinking. The holistic dentists constitute less than 1% of dentists, and in my opinion, these are healthcare salespersons rather than providers who take advantage of people's fear and dissatisfaction with the standard science-based medicine, and they basically pretend to offer them an alternative. And yes, indeed, alternative dentistry is an alternative to what has kept your teeth in your mouth for the past century of dental science. So while I really don't want to sound combative or critical of these people, I really don't think that political correctness is the answer here, and I don't think that it is ethical or even acceptable for the silent majority of science-based healthcare professionals to sit back and let these quacks misinform patients into losing their completely savable teeth. And this is really the purpose of this video. My hope is to inform the public about this misinformation campaign so that they don't end up losing their teeth and suffer the consequences unnecessarily. At its core, alternative holistic dentists create fear of bacterial infections in people's teeth, and the public basically buys these arguments for the same reason that they buy the 8 o'clock TV newscast soundbite that opens by saying, "Researchers shown that your computer keyboard is infested with bacteria." Well, yes, there is bacteria on my keyboard, but it's my own bacteria from my own skin. There's really no harm in that bacteria. Why are you trying to scare me with a non-event? And please leave me alone with all that Purell. The scientific information that most people lack is that the only time that we are truly free of all bacteria is when we are in our mother's womb. From the moment of birth on, we have basically a close relationship with bacteria, and our ignorance of this fact has been the cause of use and abuse of many antibiotics, antimicrobial agents, and disinfectants, which have now caused significant public health problems for our society. For the vast majority of human history, which spans a few million years, we've really lived with bacteria and coexisted in a mutualistic manner. In fact, the potential increase in the rate of allergies, asthma, and autoimmune diseases due to extreme hygiene and a lack of bacterial interaction with our immune system may in fact be more of a significant problem currently rather than the presence of too much harmful bacteria in our body. Here's a scientific fact that many people are unaware of. There are 10 times more bacterial cells in and on our body surfaces than there are human cells making up our body. In fact, the first line of defense in our body is not our skin, but rather it is the bacterial biofilm that coats our skin. Without this biofilm, we would readily get infected with mold and other opportunistic infections. So there is literally more bacteria in and on our body linings and cavities than there are of our own cells, and the vast majority of these bacteria and microbes are really friends which we would depend on. So we are moving towards a probiotic era rather than the old antibiotics era. But why am I saying all this? Well, it's to alleviate and to address this unnecessary germophobia that we have subconsciously developed as a result of our media and our culture. So what does this all mean about root canal therapy? Well, root canal therapy is a proven way to get rid of the critical mass of bacteria that infects a tooth without removing the tooth itself. This procedure is a proven approach to deal with symptomatic teeth with infections. The holistic folks say that there may still be some bacterial cells left in the tooth, to which I reply, there is even a higher concentration of that very same bacteria inside your own mouth and saliva. In fact, bacteria in the tooth is the same bacteria that's in the mouth. It's really not an alien species. The notion that you can only rid yourself of this bacteria by removing the whole tooth is equivalent to saying that you have to remove your whole mouth or even your whole head in order to get rid of the bacteria, and that's obviously a ridiculous notion that we can't sustain. Anyway, without getting into the science of endodontic therapy and cause everyone basically to snooze off here, I can basically say that in the US alone, nearly 20 million root canals are performed on the annual basis. And according to a large epidemiological study at the University of Southern California, USC, 97% of these teeth are still in the patient's mouth 8 years following treatment. Therefore, this is a medical procedure with odds that are superior to many other commonly accepted surgical procedures, and it helps save your own tooth. So don't repeat the same mistake that our grandparents basically did by listening to these folks and ending up with a mouthful of dentures. I'm proud to say that I've had 2 root canals myself that are now over 20 years old, and I'm really grateful for having kept my own teeth during this time. The best way to have a successful root canal procedure and save your own tooth after a toothache is to seek good care by a reputable local endodontist who is a specialist in root canal therapy, or by a general dentist which is experienced in the treatment of root canals and does root canal therapy on a regular basis. The fact is that most people with poor root canal experiences have had root canal treatments that have been performed below the standard of care, and it's often really not the procedure's fault, but rather the circumstances involved. Just let me give you a final thought before leaving you. If your hairdresser botched your haircut and left you with a bad experience, would you go around recommending everyone to shave their heads? No, you wouldn't. You would basically look for a better hairdresser next time. So we should also stop blaming a time-proven procedure such as root canal therapy and start by looking for quality care from honest, ethical practitioners with our sole interest in mind. For Real World Endo, I'm Ali Nasseh, and I wish you a long-lasting smile.